Welcome back to the Asthma Education Home Study course with me, the lung coach. I'm here to talk with you in our final lesson about peak flows and partnerships in your asthma management. One of the most effective tools in coming up with your asthma care plan with your doctor is your peak flows. This is the lung function that I had mentioned earlier in the course that we use to measure how fast your expiratory flow rate. We call it the peak expiratory flow rate. And this is an indication of your asthma and how well it's managed. Now, I actually have two components to this that I would like to talk about. First one is the peak flow meter. This is a device that you can use at home every day if you have persistent asthma. That can help identify how well controlled your asthma is. I have my peak flow device right here, and maybe I'll get a little close up here. This is the peak flow asthma meter. This one's a Philip Respironics Personal Best. I've actually included a link next to the video. I think it'll be right next to the video over here somewhere. You can get it on Amazon for about $15, and it is a helpful tool. I've also included a link on how to determine your peak flow if you have not done so yourself. Now, a little bit about the peak flow. You want to go off your predicted values at first, but then you want to do 2 weeks of this every day to determine your personal best. Once you've determined your personal best, you can decide whether or not you might have to adjust a little. Not everybody's the same. You may have to adjust for other conditions, co-conditions that we talked about a little bit. But the link will help you get started if you haven't been to the physician yet. And then you want to do this daily to come up with your personal best for 2 weeks. And whatever your best is, you go off that to calculate your zones. Now there's 3 zones: the green zone, the red zone, and the yellow zone. If you can see these little markers right here, they're green, yellow, and red here. So my personal best, or my predicted value, is up here at 654. So anything between my green zone is 450 or higher, I'm in my green zone. I don't need to take a treatment, really. My asthma is well controlled. Now, if I'm in my red zone, my yellow zone here, between the red and green, that is 50 to 80% of your personal best. So let's say you have 654. You want to take half of that, which would be 50%. My 50% is a little higher than this. This one, I must have this a little different, but you want to go 50% to 80% is your yellow zone. So that's the yellow zone there. And then if it's less than 50%, then you are in trouble and you need to go to the hospital. And you need to get to the emergency room and get treatment. So if you do this, if you're feeling short of breath and you get in your red zone, then you need to call your doctor immediately and go to get help wherever help is. So I'm just going to show you a couple times. You want to do this 3 times. The best of 3 is the measurement you would like to use. Now, I'm going to stand up real straight when I do this, and I'm going to kind of do a side view here. And you want to breathe hard and fast. You don't want to exhale slowly with this peak flow meter. You want to, as fast as you can exhale. You're going to take the biggest breath you can and exhale as fast as you can, okay? So let me show you how it looks here. Ooh, I'm a little low there. I got a 630. You can see the indicator spot go up there. But I'm in my green zone, so I do not need an albuterol treatment right now. But we're going to do best of 3. That one I got 620, so that's okay. That's not my personal best, but let's see what we can do here. Ah, that's closer. 650. I'm really close to my predicted value of 654 for my age and height. And you're going to see that on that link. It's going to ask you for your height and your age, and that's going to help determine your predicted values. That's how many, that's average for your age and height. So I'm going to do one more here. See if this is my best one. Aha! It is my best one, and I even went a little higher than my predicted value. I got 680 on that one, so that's pretty good. I used to be a swimmer. I'm an athlete, so I think that helped with my asthma, which I do personally think that helps if you are an athlete or even just exercise regularly. It will help your asthma. I always recommend that to my patients. But this comes in a little nifty little case here, so I can take that with me if I need to, and use this, get this. It's $15, or your doctor may even give it to you for free, and it's very important. Now, as you do that every day, or depending on your doctor, he may tell you you don't have to do it every day if you have mild intermittent asthma, but with any type of persistent asthma, I say you should do it every day. It should just be part of your thing, because when you are looking for triggers and how to manage your asthma, you may not realize you're having symptoms. You may just kind of ignore it. A lot of us ignore it and just push through it. But that helps to keep that diary. You just make a little note of where you are in your asthma management and your peak flows, and that way you can see trends down or up. You can give this information to your doctor, which leads me into partnerships with your healthcare provider. The more information your doctor has, the better asthma management care plan or action care plan he can come up with you. So keep some of this information. It's very important, especially early on with your child's asthma or your asthma, to track your peak flows, to track your symptoms. You may even make little notes. I went to the farm today and I had really bad asthma symptoms, had to use my rescue inhaler 3 times. Well, you may have an allergy to a pollen or a ragweed or a hay fever out there that you need to identify. So that's good information your doctor wants to know, or your respiratory therapist or your nurse. Whoever you're working with to manage your asthma, you want to give them the most information possible, because that helps identify triggers, helps come up with the right medications, and it helps you customize your asthma care plan. So I hope this course has been helpful to you. And if you have any questions, you can email me at hearttolungs.com. I love feedback too. If you have any suggestions or comments, please feel free to email me. I love educating and I love talking about asthma. So if you are watching this video and have any other questions, please let me know. I hope you enjoyed this. Thank you for joining me.